In this video, we take a look at the basic operation of the Combi Carrier 2. The Combi Carrier 2 is a two-piece unit consisting of two identical sections held together by two latch levers. It is designed to be used as a one-piece hardboard or as a two-piece scoop. The board weighs 7.1 kilograms unladen, and in line with manual task training has a patient weight limit of 150 kilograms for lifting and carrying, and a maximum weight limit of 205 kilograms for dragging and bridging. Each Combi Carrier 2 has a set of 4 yellow speed clip patient restraints that can be used to secure a patient. The existing spider straps can be used as well. The Combi Carrier 2 is suitable for use to replace both the scoop and the hard spine board for all manual tasking and extrication requirements in line with AT's current manual task training. Separate the sides of the Combi Carrier 2 by grasping both sections of the Combi Carrier 2 and pulling back on the latch lever tab. After the latch lever tab has been pulled back, separate the two sections of the Combi Carrier 2. First of all, explain to the patient what you're going to do. Before separating the Combi Carrier 2 in half, place it next to the patient's head so that the top of head grooves are lined up with the top of the patient's head. The Combi Carrier 2 is 186.7 centimetres long, and some patients may extend beyond the length of the Combi Carrier 2. Check as to whether or not additional support will be required. While one attendant maintains support of the patient's head, separate the halves of the Combi Carrier 2 and place one half under the patient. Additional personnel may be required to slightly lift the shoulders and the hips of the patient in order for the Combi Carrier 2 section to slide properly under the patient. The patient does not have to be log rolled when using the Combi Carrier 2 in this manner. Make sure the first half is properly positioned under the patient, and then slide the other half of the Combi Carrier 2 into position under the patient. Secure the latch assemblies one at a time. Recheck both latch assemblies to ensure that they are fully locked before placing the restraints on the patient. The Combi Carrier 2 is packaged with 4 two-piece patient restraints. 2 straps are used to form an X pattern across the patient's chest. The 2 chest straps should be secured behind the patient's shoulders and wrap around the top of each shoulder. The pins on the board allow various strap configurations to be used. Make sure the restraints are not tangled, and then secure them snugly, but do not impair the patient's breathing. One strap should be positioned at the hips and one strap above the knees. You may need a 5th strap for the patient's feet if extricating on the board or over a long distance. Place a towel between the patient's ankles and create a figure-of-8 loop around the patient's feet. This can be done with the yellow Combi board straps or with a seat belt. The Combi Carrier 2 is for use as an extrication device, and as such, patients should not be immobilised on the board for transport times greater than 30 minutes.